No.
Technical problem
Yeah, like that.
Well, a few weeks ago, we showed you how laser surgery can take years off your face. This morning, we're going to show you another technique. Now, lasers are getting rid of excess unwanted hair from the face, bikini line, even the arms. Dr. Bradley Calobrace has recently added this to his practice, and he's here in our studio this morning to show us how it works live. Thanks for coming out today.
Well, you're welcome.
Thank you.
And here's the machine, so it's portable.
This is very portable compared to the other lasers, if you've seen them before, which are very large and bulky and actually kind of have to stay in the hospital or in the office. This is very portable. Actually, this piece splits into two, and you can throw it in your car, and that's how we got here to the studio today.
That's
Amazing.
great.
Much
so
smaller.
It's new technology.
Very new technology. This was actually just approved by the FDA in February.
Wow. Is it permanent hair removal?
Well, we believe it's permanent. It takes more than one treatment, though. This laser actually works on only growing hair. And since only about a third of our hair is growing at any one time, it's only going to treat that hair, which means you're going to have to come back for repeat treatments when the hair's growing, the other hair that you haven't treated. But after a couple, 3 treatments, it should permanently remove the hair.
Okay, and we've got a patient here.
We do.
How are you today? Good.
This is Chris Lally, and she wants to have her legs done. Now, the laser can be
nice.
used for everything, men and women, and in almost every location. Legs and backs and chest. For women, it's usually the legs.
Okay.
Or a mustache if they have it in some of those areas.
Bikini line, probably.
Bikini lines,
Okay.
very important.
So what do you do first? We're going to start the treatment in our next segment. What's the first thing you do before you even get the laser going?
We have to evaluate the patient, see if they're a good candidate. Now, Chrissy is an excellent candidate because she has very light skin, and she has dark hair on her legs, which of course is the reason she wants to have it removed. That's the perfect candidate for laser. The darker the skin, the more difficult it is for the laser to adequately treat it. So then we have to pull down the energies a little bit, so it may take more treatments when somebody has darker skin.
So you're actually going to do this live on our show.
We're going to do
with
this
the
live
laser.
with the laser.
All right, we have to wear dark glasses later
have
on.
to wear,
Right.
Very important to wear
Yes.
goggles.
Okay.
Laser safety is critical.
Okay.
All right.
Well, we're going to take you through the steps first. First, we have to shave her legs, right?
Well, they're pretty shaved at this point in time. I don't see much hair. Any area, I don't think for her we wouldn't, but generally you start treatment by shaving.
Okay.
A little bit of hair isn't a problem, but a lot of hair would be a big, especially like a hairy back. Hair has to go.
So that's an
Okay.
option, too. You can get rid of the hair on their
The old
back.
hairy
Absolutely.
back. Right.
Chest, beards, and men that are,
Oh.
or people that have a lot of folliculitis and problems with shaving.
Right.
It's a great
Yeah,
medication.
sounds like it. Okay, well, we're going to get started in our next segment.
Great.
Okay. And another medical news.
The mood.
Yeah, we're going to check back on that laser surgery in just a minute. We're removing hair from a patient's legs here in our studio this morning.
A step-by-step process. There you see the procedure underway.
She looks pretty relaxed,
Yeah.
pretty pain-free, she says.
Each one of those flashes is a hit of the laser. Oh, we should have our glasses on now.
Oh, yeah, I guess we should. Forgot
My
about
goodness.
that. Oop.
It's okay if they're watching at home, right? They don't have to wear glasses at home, do they, doctor?
Not really.
Otherwise, we'd have
not,
to...
That's extreme laser safety.
Okay.
Okay, that's Dr. Bradley Calobrace. We'll check in with him for a laser update.
We'd have to pass out goggles to all of our viewers otherwise.
Right. Kind of like that 3D.
Yeah, exactly.
Everybody wears the glasses.
Fox in the Morning
theater.
3D.
Yeah. Well, it looks... Well, we're checking back in with Dr. Bradley Calabrace, who's here performing the latest technique in laser surgery this morning. It's hair removal, and we've got another patient. This is Jean. And Jean, you've already had some work done, right?
Yes, I'm on back.
Can you tell us about this,
Well,
Dr. Calabrace?
today we're going to work on his chest, and especially he has hair that extends up onto his shoulders and his neck. I've already shaved that in preparation for the laser, but he has pretty much hair distribution over the whole trunk, both the front and the back. About a month ago, we treated his back, which had hair very similar to the front. Let's have him stand up and show.
Jean, I think we've got a camera behind you there, so
Right
just
there.
stand right there. And,
And you can see that he has
Look at that,
absolutely
it's completely
it's
clean.
very, very smooth, and he's had almost no regrowth at 1 month, so we're very happy.
He had a hairy back.
He had a very hairy back, just like his chest. You can sit back down. What's interesting is that he has a little darker skin, has tanned, and still he had an excellent result with this, with no skin injury or any problems at all, no pigmentary changes to the skin. So he's responding very well to the laser.
And
So
we're going to do the chest hair next,
just
right?
do the whole chest hair
What have you
here.
done to prep it?
What we did is we've shaved it. The laser light, when it hits this, if we have hair sticking out, it will actually burn that hair. So we really do like to shave it down so it's very smooth. So the hair went up onto his neck, and you see how smoothly I shaved that prior to treating it with the laser. And that will help us from getting energy absorbed into that hair.
Okay, so we'll start on
start?
the chest with the laser surgery in just a few minutes.
We're ready?
Okay.
All right,
We'll
thanks.
check back.
And coming up next, Kevin.
Surgery. We're with Dr. Bradley Calobrace this morning. He's brought his laser equipment into the studio to show us the latest technique. It's hair removal, and you've got Gene, the patient, here. You've done a great job removing the hair on his back, and now you're starting on his chest.
We're going to do his chest.
So if you could just start that.
We'll start that and show how this works, and this is not a painful technique at all.
When will we actually see the results from this? It doesn't show up right away. Does the hair just kind of fall away? Or
it does. After about 7 to 10 days, the hair will start growing, and then will kind of fall out, and then you'll see. And all the growing hair should be gone at that point in time. Then you wait. You want to see how this does?
Yeah.
And we're going to just start going through the whole hair.
Can you feel it as he's doing this?
Barely.
See the flash of that laser. Look at that.
Does the skin get irritated later, Dr. Calobrace?
It gets a little red, and so I'll go through the whole area and treat. And we just quickly we can move through all the area. You see a little dark where the hair's turned a little dark here.
Yeah.
That means that it's absorbing the energy. So then at the very end of the treatment, we'll actually take an aloe spray. We use this Biomedic toner, and we just spray that all over the area, and it's kind of soothing. This feels kind of like a sunburn for a few hours.
I can smell something. It smells a little
That's
like
because of the little hairs that turn dark, you can smell that burning.
Oh.
So we do try to shave very closely so we don't smell that too much. It doesn't do a lot for practice if you have that smell going through your office.
Now, how much is this procedure? How much is the laser surgery to remove hair on, say, a beard or your legs or chest?
Right. If it's a certain area, like a small area, the upper lip, it would cost $250 to do. If we do a larger area, we found it was easier to treat by the hour, charge by the hour, and it's $400 an hour. So for an hour, we could do his whole back in an hour. So that's for $400. So that's very inexpensive, so it's great. This machine was a $150,000 machine, so it's small but mighty. And so we do a lot of patients, and we can do large areas, do it very quickly, very little pain, very little no downtime really, no reaction to the skin, and have some permanent hair removal.
Yeah, what do you think about the results? You've had the...
I'm 100% satisfied.
Thrilled with it.
Yes.
Let's put Dr. Calabrace's phone number on the screen if you'd like to get in touch with him for more information or to set up an appointment to have the laser surgery done. Can you tell us your number there? It is 629-5330.
That's it.
And it's light shear diode laser treatment, right?
That's it.
Okay.
Thanks for coming in
out.
today and
Thank you very much.
Yeah.
Thank you very much. We
Good
enjoyed
luck
it.
with your treatment.
Right.
Thanks.
All right, let's go over to Hamilton now and the latest news of the morning, including that cold snap.
Yeah, we're talking about that cold weather once